Hello and welcome to Criminal Justice Inspection Unpacked, the podcast of Criminal Justice Inspection Northern Ireland. I'm Melanie McVeigh, and in this episode we're looking at the work that's been ongoing in our prisons to improve the operation of our Care and Supervision Units, or CSUs. Those are the specialist units accommodating men and women when they are segregated from the general prison population. Joining me to chat about the findings of the CJI follow-up review are Claire Finlay and Julie Anderson from the Northern Ireland Prison Service. Claire has worked in the prison service for 16 years, starting off as a night custody officer and taking on a range of other roles before progressing to her current post of Governor in charge of residential and prisoner safety at Maghaberry Prison. Julie is Head of Prisoner Wellbeing and is the healthcare lead for the prison service. She has corporate responsibility for areas falling under safer custody, contributes to prison service corporate governance, and engages with healthcare partners. She has worked in the prison service for over a decade. My final guest is Maureen Earn, Lead Inspector from CJI. Maureen joined CJI in 2020 and since then has played a key role in all prison inspections and those focusing on other places of detention. Prior to working in CJI, Maureen worked with the Prisoner Ombudsman's Office. Ladies, you're all very welcome. So let's get started by just explaining the background to the follow-up review. Claire, I'm going to come to you first. You have responsibility for the CSU at Maghaberry. Can you perhaps tell us what are CSUs for and why might a prisoner be placed there?
Yeah, all establishments have a care and supervision unit. And the purpose of the Care and Supervision Unit is to have an area where individuals who are causing disruption to the regime, perhaps a risk to themselves, a risk to others, will be relocated there, and they'll be there for a period of time. It gives us an opportunity to observe their behaviours, observe their risk, and see what support we need to reintegrate them back into normal population. Okay, and what's the process of actually getting somebody into a CSU? There must be a few steps you have to follow. Absolutely. This is led by a management role, so an officer or a senior officer couldn't decide to put an individual there, although they could recommend it. It has to be a governor grade, and that there's just to ensure that we look at the information and we are confident that the need is for them to go there and that they couldn't be relocated somewhere else within the establishment. So it's not something you're doing willingly, it's something that it's a requirement rather than a choice as such. Absolutely. Given an opportunity to manage someone in their normal residential location or perhaps move them to another location. For instance, if somebody had a disagreement or a fight with an individual in a landing, they don't necessarily need to go to the CSU. They do need to have some intervention work done, but they can go to different residential locations. It's the CSU is the last resort to manage and discipline. Maureen, maybe I can turn to you. CJI initially looked at CSUs in 2021, and then there was a report published the following February. Can you tell us what prompted that piece of work?
So the initial review was prompted by concerns that were raised with the then Minister about the treatment and conditions of people in CSU, and the Minister then requested a review of the Chief Inspector. And that review then commenced in the early part of 2021, and we did extensive fieldwork in the prisons. Looked at a range of documentation, sample files, spoke to managers and staff and prisoners. And we produced, as you say, and published the report then in 2022.
CJI regularly does prison inspections. What was different about this particular piece of work?
Well, this piece of work was outside the process of the regular and the routine inspection, and obviously, segregation itself forms part of every unannounced prison inspection. This one had been raised on the back of particular concerns, and we did an in-depth review.
It was very focused on.
It was focused on, this was a different thing as well, which was interesting in this piece of work, which usually a prison inspection will happen around once every 3 years, but in this piece of work we were working across 3 CSUs at the same time, and you were able to look and compare and contrast then the treatment and conditions across the 3 sites, and that is different to the normal prison inspection process.
And can you tell us a little about what you found and what you identified that needed to be changed?
So the main findings were that the regime experienced by some CSU prisoners did not meet UN standard minimum rules. So we found that some prisoners spending too long in their cells within CSU without meaningful human contact. We were also concerned about the lack of oversight and governance around the operation of CSUs. We identified that, and I think it wasn't new to that inspection because it had been identified previously, that some people with mental illness were detained in CSUs, not because of their mental illness, but because of the behaviour that resulted in them needing to be segregated from the main population. We also identified opportunities to improve the learning and development for staff who are working in CSUs, because they are very challenging places to work, and people present with very complex and challenging behaviours. So that was another element of the review. And then I suppose the other aspect then is looking at the regimes and facilities for people that were living in CSUs at that time, and to what extent they were engaged in purposeful activity. And
it's activities and time out of their cell, things.
Yeah, and also within cell as well. So we did identify at the time there were numbers of people who did not leave their cells at all for extended periods.
So there seemed to be a number of issues that were there. Julie, perhaps I can turn to you then. How challenging was this as a finding and as a report for prison service?
It was an incredibly challenging report, particularly on the back of the work that staff do on a day-on-daily basis. And it's hard sometimes to receive those messages whenever people are doing their level best. The prison service rose to that challenge, however, the report presented. And as a service, we didn't wait for the final report to publish. We acted on the draft report, and particularly around the criticisms in the report around the lack of recording and the inability to be able to see the length of time that people had been in the CSU during the day and so on and so forth, and also looking at the monitoring side of it and that. We actually very, very quickly identified how we could enable staff to do things in a different way. And that resulted in a business case for a new IT solution, a very innovative IT solution that took account of new hardware as well as software that would allow our staff to do that recording in a way that didn't impact on their ability to interact with people, because the balance there is around how do you have all of that recording done and actually do the interaction that you need to do with the prisoners who are held within the CSU.
I'll come back to you, if you don't mind, about that IT solution and chat to you a wee bit more about that later on. But Claire, maybe could I turn to you? What about, you were working in the prison at the time. Well, how did staff feel about the report? What were they reacting?
Well, as Julia touched on, whenever you get a report that doesn't read so well, it's very hard to pick staff back up from that, especially when you know that there is a considerable amount of work that had been going on. I had actually just arrived in Maghaberry whenever the initial inspection had happened, and I knew by the questions that they were asking that we needed to act because there was things that we weren't delivering. And that was when people went into the CSU, there could have been education packs sent over if they were engaged, but the teacher wasn't in, and that's where it had stopped. So before we had actually received the report, we had already started to make inroads with what we thought were going to be the challenges coming out of the report. So whenever the report arrived and the staff were feeling, this isn't great, we're doing a lot, it was good for them to actually see, well, we'd taken proactive steps, and we hadn't sat back and waited to hear this is what you're doing wrong. We actually took the time to, look at how we were delivering and what we weren't delivering, and how we could, make the care and supervision more person focused, and that was the direction of travel. So whilst the report wasn't great, it was easier to bring the staff along with us, because I was already able to say that says that we weren't doing, but we actually are doing that now. And, and the staff took pride in taking the area forward. The partners fully engaged with coming into the CSU, because you can imagine if you're a partner and you're told for so many years, well, you can't go into the CSU because that individual's been moved there because of, they've been violent to someone else. But we actually had the facilities in there to manage that. So it was bringing our partners along with us as well to say, this is probably when they need you most. So let's not stop it at the door. And that's where our journey began. So to say that the report wasn't great would probably be an understatement for me, but to say that we had taken it very seriously before the report was published, I'm confident that was our position.
Okay. Maureen, so maybe 18 months have passed now. Why was it important for CJI to go back in?
I think primarily because of the concerns and issues that were raised, arising from the initial review, and the Chief Inspector at the time had said that she intended to maintain a focus on delivery against the recommendations. And the prison service is not alone, like a number of other organisations. There's a heavy weight of recommendations coming from different reports. So the concern would be that, despite the best will in the world, that progress may not be made, but the issues were so significant that we wanted to see that that change be effected. And we had been involved. The prison service had brought us in May time, Julie, I think it was, in terms of giving this an update on the direction of travel. And that was still relatively early days, but plans were being formulated or had been formulated at that stage. So really it was about assurance that the messages had been received and understood, and that there had been work commenced to address the recommendations. And that's why we did the follow-up review, and that commenced towards the end of the year.
And what did you find this time round, Maureen?
Well, I'll just maybe explain a wee bit about the process as well, because the follow-up review process is a much narrower piece of work, because what we will do then is go in and look at the specific recommendations. We asked the prison service to produce a self-assessment, so that they would look at the recommendation and provide evidence to us of how those recommendations have been addressed. And Julie was the person who was nominated to do that and coordinate all of that material across the prison service. And Julie was very good in organising briefings with the different leads. So for the estates lead, and understanding what plans there were around accommodation. With IT, it was yourself, and other aspects of the work as well. So that was really helpful. So in terms of the findings, we were very impressed with the pace of the work that had been undertaken. So when we were back on the ground, then we could see that there were robust plans in place, and we could see evidence of some of the changes that were beginning to happen. And obviously time has passed since we did the fieldwork for the follow-up review, and I'm sure there have been ongoing developments. So yes, it was for us looking at the self-assessment material, and then been back out in the ground to test that evidence and to triangulate that as we normally do in inspection, and then form an assessment of whether what had been achieved, partially achieved, not achieved. And for some of the areas, we did find that some of the work had been achieved, and in some of the areas partially achieved. But partially achieved doesn't mean that nothing was done. Partially achieved would mean that we could see that there were plans in place. There was evidence of improved outcomes, but time was needed to further continue with that work or embed the change. So overall, we were very impressed with the pace of change and what had been delivered in that time period. And there is still ongoing work to do.
Julie, did you find that were the timeframes that were set within the recommendations, were they an issue, or did you see that as an opportunity to move the projects forward?
Part of it was a challenge, and that sort of, I led the work to respond to the recommendations that were in the report, and some of the some of the recommendations, the timescales that were attached to them just simply were not doable, particularly around, and Maureen had mentioned about the plans for the accommodation works and the yards and so on. And the plans that our architect, Karen Crowley, had drafted up are fabulous. And Maureen and some of the other Sejeni and ETI people that were involved in the follow-up review got the opportunity to see those. But all of that takes time, and business cases and contractors and so on. So why we had this vision that was led by Karen for the accommodation, actually getting that implemented is a whole other ballgame. But we have made significant progress in that area as well. In terms of what we could do around enabling staff to do their job, that we did very, very quickly. And in fact, the report was published on the 6th of February 2022. We delivered the first phase of the IT solution on the 31st of March 2022, which gave that capacity for oversight. It gave the capacity for recording, and our IT staff round in our prison team, and also our IT providers, Sop Wisteria, did an absolute fantastic job, because we introduced new handheld devices that allowed very, very easy capture of real-time information that then was visible through the production of an oversight screen that allows you, a manager or anyone else, to go in and have a look for every single prisoner that's in the CSU and see what activity they have had, how many minutes they've had out of cell, what they've been offered, and if they've refused to go out, why they refused. So there is a lot of information packed in there that has actually made the job an awful lot easier for our staff, but also for our managers, because things aren't being held on a piece of paper anymore. Anyone who has access to that IT system can go in and view that information and get the information that they need. But also, in looking at in that context, we didn't leave it there. We decided, no, hang on a second, let's go further. So the design principle around that was, let's look at the key business processes that light with the CSU, and let's digitise what we can. So we've had 3 phases of delivery, which has included management planning, risk assessment, exit planning, transition planning, that we delivered in January 23. It's been such a long time. January 23, then in April 23, we delivered the Rule 32 functionality, which has had huge benefits for staff as well as for the prisoners, because in the establishments and also at headquarters, people who are involved in the entirety of that approach can actually view that information now. And we have our last phase due to go live in November, which is the adjudications module. So it has been a long time coming, but we used a methodology which meant that my vision was what we were going to deliver, but how it was put together, it was staff. And Claire was one of the individuals who was involved from a governor perspective. We had staff, CSU staff from all establishments.
They were contributing to the process. They were very much active partners.
They developed it. So I stood in the background and went, no, you can't do that. Or you can do that. And the actual build was developed by the people who do.
Do you see that as being central to it being successful and being that game changer, because you have buy-in from the staff to begin with, but also they're actually telling you what's going to work for them on the ground, rather than capturing information that may be beneficial at a management level, but for actually those people that are there on the day-to-day doing the job, it's maybe not what they need to hand.
It is about empowering people who do the job to shape their job. And that's exactly what we did. Because as a manager, as a headquarters manager, I don't know what people do day to day in the CSU. Claire will have a level of knowledge as a senior governor, but she's not actually doing the day-to-day job in the CSU. So the importance of bringing the people together who actually do that job to shape how they do it and how it will work, and to be able to build in those little anomalies, because we have women in custody in Highbank. We don't have them in our other sites. We have young men in custody in Highbank. So there are little anomalies which have all been captured within the build and the design of what we have done. So it has very much been a feature of how we have moved forward with the key business change, and again with the learning and development, which Maureen referenced earlier.
I'll actually pick that up with Claire, if you don't mind, Julie, because you were, as you say, you were in the facilities. What do you feel was enabling the progress to be made? Was that sort of connection between leadership and staff on the ground essential, really, to make it work?
Absolutely. And as Julia said, with regards to the digital solution, the staff knew what worked and how they could make someone's day purposeful, but also how they could capture it. And I think you touched on, yes, we could evidence the out of sale, we could evidence that they were getting their showers, they were getting their phone calls, they were getting their yard time. But for the staff, it had to be person-centred. It wasn't just stats. It was being able to bring up the new overview screen. And if someone was sitting in red, that was an alert. That was the first opportunity for them.
So that's a trigger to say we need to go and engage with that individual?
Absolutely. And then staff were confident in reaching out to our partners to say, Claire has been in her cell, she is refusing to engage, the overview screen, clearly evidences this, but it's not just for us to say we're content that everybody in the CSU has had that time. It's capturing those that perhaps maybe don't need to be in the CSU and making sure that we action that immediately. And staff have grown in confidence. They have the work with our partners has really strengthened with the staff here on the ground. And before, it had been very senior officer, very governor led, and very fragmented between.
So there's greater collegiality now around those staff from whatever aspect of the prison regime working in the CSU.
Absolutely. And also the staff have a real confidence because they have brought our governors along with them. They have led on this, the digital solution, and they're going to other areas and seeing how it could work. We haven't just sat on this and said, okay, well, that's a CSU covered. Staff now who are out and have maybe moved into different areas and are working in safety, or they're working perhaps in the committal house, they're seeing how the digital solution could be lifted and put into these other areas where there's
transfer it to other parts of the prison operations. What about, it's one of the things that I picked up on in the full review was around additional training and support now for staff. Can you talk us through a little bit about that and what difference it's making for those individuals?
Yeah. The staff in the CSU, there's no doubt that they manage a lot of individuals with complex needs, and many with personality disorders. And whilst they do need to be in the CSU because of the risk they present to others, managing those behaviours can be very difficult. We have invested a lot of time in the staff and with our partners in training to manage people with complex needs, but also to manage themselves. And to recognise whenever they need support and supporting others. And the staff have really relished in having that investment, because when we come in and we train as prison officers, we're trained very much in, safe, secure environment. But we're now moving towards the different needs of the ever-changing population that comes in, and recognising that a lot of individuals come in to custody with underlying mental health issues, addiction issues, and having that training. We work very closely with our partners in SET for Lunch and Learn, and they will look at specific areas and manage people with schizophrenia, manage people with personality disorder, looking at triggers, and investing that in our staff is helping them to recognise that, somebody previously may have been thought as, oh, they're just being bad, or, oh, there's no talking to that person. People are now reaching out and saying, do we need to speak to the speech and language therapist? Do we need to get other people involved? Do we recognise traits in their behaviour that, and one size certainly doesn't fit all whenever it comes to people in custody.
Well, that's one that we can't lose focus on the people that are actually in CSUs and those that are in custody. What difference have these changes been making for those men and women that are actually placed in the CSU? What differences have you started to see on the ground for them?
Well, from a staff point of view, when you look at the people that come into the CSU and those that return, it used to be a revolving door. With the new processes and looking at working closer with our partners, bringing people into the CSU, when we're moving them out and that transition piece, people are settling a lot better back out in general population, because it doesn't stop there. We check in on them. We see that they've been followed up with the referrals and they're getting that continued support. There was a reason that they come into the CSU. So we need to ensure that the processes, while they're there, support them, but also that their support as they go back out into general population. And we have seen a very settled population. We also see people in the CSU for a shorter period of time, because a lot of that work can happen back out in general population. So it's bringing them in, understanding what the risks are, understanding what their need is. And as Julie said, that transition piece. So what can we do whenever they're back out? Because we want them back out
as soon as you can, really.
Yeah.
Okay, well, that's great. That's terrific, ladies. Thanks for explaining that. But I'm going to come back to you now, Maureen, if you don't mind. Why do you think it's important to have the level of transparency that now appears to be available?
I think obviously, prisons are a place of detention and your liberty is restricted, and also, and layer on top of that then being segregated from the main prison population. There are obvious safeguards that need to be in place to monitor and have good oversight of that detention, because of the impacts potentially it can have on well-being and mental health and progress through the prison. So it was vitally important, and I do echo, everything that Julie and Claire have said, because when we were on the ground doing the follow-up review, that piece around staff was so important, and the conversations were different, than we had been on the ground the first time round, and people were saying, and challenging, why is that person still here? Do they need to still be here? But also conversations around why that person might, what were the behaviours there? And I think Claire deserves a lot of credit as well in terms of that. You've introduced the weekly overview when you're drilling down into each case, and there's particular oversight looking and saying, okay, where are they at? What are we doing? What's the plan for the future? Who do we need to get round this table to engage with that person? And sometimes it was working well, and sometimes, it wasn't, but you kept going at that. So yeah, I think, ideally, what you want is people living in the main population and not segregated from their peers. And we saw a lot of good progress that had been made. We haven't touched so much around purposeful activity, but, we did see examples now. One of the recommendations dealt with where people were, once they went to CSU, and Claire mentioned this earlier, a lot of activity actually stopped because they had been segregated. But we did see examples now where learning and skills were being routinely notified that someone had been relocated to CSU, and teachers were on the ground in CSU on a weekly basis, picking up on all individuals, not just those that were engaged previously in learning and skills.
So where do we go from now? What do you want to see happening in the future, Maureen?
So in the future, really, it is to continue the journey that the prison service has been on. There are some plans that still need to come through to fruition, particularly around accommodation plans at Maghaberry specifically. And also that we've heard a lot about the new systems, which were innovative and very impressive, but it's actually what you do with that information. So management reporting when we were on the ground was still developing. So it's really how that information is used to safeguard individuals and monitor their detention in CSUs, but also to improve service delivery. So I'd like to see that journey continuing. And also around, Claire mentioned around person-centred care, I suppose it's cautioning people to where you have a system on a computer that it doesn't become tick boxy. And it really is centred around that person's assessments and their needs. And really, I suppose, the other piece of work that Julie led on was around the development of the operational framework to give that visibility around, what are CSUs there for, what are the principles that underpin it, and what do we want to achieve. So there were measures as part of that plan in terms of what are we actually achieving. So there's a lot of activity and work has been completed, but what is it achieving? And I just make one final, because we haven't really mentioned it up to now, but I think the other good piece as well is a lot of good feedback from staff when we were on the ground. The prisoner experience was different when we were back on the ground. So they were reporting a better experience of having been in CSU. So that was very positive to hear as well.
Well, evidence base was now available. Well, ladies, I'll turn back to both of you, and I suppose it's a challenge for both aspects on the ground and headquarters staff. How do you maintain this positive progress, and is that going to be a challenge for prison service?
Well, if I maybe come in first on that, Claire has talked about some of the development that staff have had. The underpinning point for moving forward with the staff development was the completion of a learning needs analysis. And there have been a number of new training products that have been introduced as a result of that, bespoke training products that only exist in the Northern Ireland Prison Service. For example, psychological first aid training has been developed specifically for our staff and delivered, which doesn't exist anywhere. Also specific training around human rights, but specific to the CSU. So there has been a large focus on opening staff's minds to looking at things in a different way. And the feedback, which was delivered by one of our partners in Ulster University on the human rights aspect, for example, the feedback from it was absolutely fabulous because the staff were so engaged and actually just giving people that opportunity to be away from the prison for a day in Ulster University. Hearing these messages and having those conversations is incredibly important. But development, people should never stop developing. Lifelong learning, I'm a massive fan of. And there is more that we can do that presents a challenge for us organisationally because we've had this huge increase in the prisoner population. Our staff are stretched, so the capacity to release people to complete training activities and that is reduced within the operational context. So looking for different ways to actually deliver that to ensure that people are upskilled. And there's all sorts of different ways that you can learn something, which doesn't necessarily mean bringing people out into a training room. And as far as the Maureen had picked up on the, so what are we all doing with this information? We have our strategic Safer Custody Steering Committee, and the scrutinisation from an organisational perspective is focused at that particular meeting now. Care and Supervision Unit, that's where it happens. We have introduced, because actually the voice of the people in custody, the people who are being held in the CSU is very important in all of this. So we've just introduced as one of the performance measures under the CSU framework, a really tight questionnaire that people will complete whenever they have finished their stay in the CSU. It's tight. There's only 10 questions that are asked within it, and it's done in a very simple, easy way for people to be able to give that contribution. So we've only introduced that just from the 1st of September, and that the outcomes from that or outputs from that will be reported into the Safer Custody Steering Committee, which will give us that oversight of what's working well, what do we need to do better or do we need to do differently, and is it appropriate that we do it differently? All of those sorts of questions will be dealt with at that particular forum from a corporate perspective.
So there's an appetite for continued learning and continued development within the organisation.
Absolutely. Julia touched on it, and we have invested a lot of time with the staff here in the CSU, but we also recognise that with the ever-changing population, that basic training for the staff coming through, and there has been pieces of training that have been now incorporated into the basic training for staff, psychological first aid, different training programmes that Julia has introduced to try and inform our staff whenever they arrive that they're not just managing people that have committed a crime, broke the law and are in our care. We're actually managing very complex needs and giving them that awareness of what they are coming in, the environment that they're coming in to work and support people.
Just you've touched there on further developments. There is work is there work ongoing to address those recommendations? There's elements that need still to be completed.
There is, and I think one of the things that's important to say, because Claire and I both are here from the Northern Ireland Prison Service, there's more than the Northern Ireland Prison Service involved in this.
South Eastern Trust are key partners, as are Belfast Met and their partners up in the Northwest Regional College as well.
Exactly. So, it's not just about the prison service delivering, it's about our partners having to step up and deliver as well. So where there are elements that are joint, we're working very closely with our partner in that. For elements that aren't, and the principal element that hasn't been delivered yet really is around the accommodation, which I've already spoken about.
But you're confident that's still going to progress through to completion?
It will, because the funding is there to deliver it. It's those things that you have to get round when you're dealing with accommodation.
And the public sector.
And contracts and building supplies not actually being available because of the ongoing impact of the pandemic and so on and so forth. But where there's a will, there's a way. And from the Northern Ireland perspective, Northern Ireland Prison Service perspective, we have the will with bells on to make sure that this happens.
Maureen, that's good to hear. But what will CJI be doing to monitor progress and just make sure that sort of fatigue that can go with implementing recommendations doesn't occur, and that slippage doesn't start to creep in for reasons maybe within the control or outside of the control of the prison service?
Some things, strategic recommendation 2, which was looking at provision for people with mental illness within custody. That is going to take place over a longer period of time, and one of our observations in the follow-up review was accelerating that in terms of people being removed from custody into more suitable settings. But to come back to your question, yes, we intend to follow up within the context of normal prison inspections going forward because of the degree of progress that has been made here, and obviously we'll be working with our partners in the Regulation and Quality Improvement Authority and with ETI, looking at
Education and Training Inspectorate,
looking at the provision around learning and skills. So yes, I think it is a piece of work that will continue to be monitored and reviewed, but it is impressive the progress that has been made to date.
Well, it's encouraging to be hearing those positive messages, particularly in response to what was a challenging report for the organisation with tough messages for those that are working within prison service. So maybe as a final question to all of you, what would you be saying to either the family or friends of prisoners who either are held in a CSU at the moment or may find themselves with a friend or relative in a CSU in the future? What would you say about the experience and what it will be like there now?
I think that if I was speaking to and have spoke to families with individuals who are in the CSU, that they can be confident that we're doing everything that we can to support them, to address their needs, to understand the reasons why they're there and look at how we can progress them out. It is absolutely person-centred, and it is a care and supervision unit. It is what it says on the tin. It is about care, and that's our focus.
Julie, it is a part of the prison system, it's part of the prison. What would you be saying? Is there anything you'd add?
Well, what I would say is that this is, again, this is not the prison service doing this on our own. We rely very, very heavily on our key partner agencies, the like of the South Eastern Trust and also the Belfast Met. But there are lots and lots and lots of other people who are involved within, we have our chaplain site. We have other visitors that come into the prison service who are there to support people. And there is that, particularly now that we have very formalised the risk assessment, the management plan, and also the exit planning, which is important because there is a bit of personal responsibility with the individual around the behaviours that they are displaying. And, so there's that collective. We don't put people into the CSU to punish them. The punishment for people is being put into prison in the first place. Our job as the prison service is to support the individuals who are in custody and to challenge them to change and to support them in that change. And that's very much about what we do within our Care and Supervision Units.
Maureen, finally to you, what would you be saying to those relatives or family members?
I suppose the key thing for us would be that, we now have greater assurance around treatment and conditions for people, and that there is real ownership of that journey and that improvement by prison service and the partner agencies around that. So all of our work, shouldn't be about implementing a recommendation for the sake of ticking a box. It is about that continuous journey of improvement. So I would say that yes, we are very encouraged by the findings, and it's really about sustaining that progress.
Sounds like it's one of these times where inspection can actually be an enabler for change, though the journey might be a wee bit bumpy along the road. Julie, Maureen, Claire, thank you so much for your time today and for providing that behind the scenes view on how the work to implement the recommendations has been progressing and what's been done to deliver the better services, outcome and support for prisoners, staff and the community through that pathway. I look forward to joining you again soon for another episode of Criminal Justice Inspection Unpacked to see what's happening to deliver a better justice system for all.